As the state begins reopening, many people continue to struggle with the pandemic, the shutdowns, and the economic pain. That also means a continuing need to help people get food in a way that's safe and accessible. Part of the effort is the work of a nonprofit called About Fresh, which has been focused on disparities in health and food access for the past few years. Joining us is its co-founder and CEO, Josh Trautwein. Thank you very much for being with us, Josh.
Thanks for having me, Chris.
Josh, I want to go back to how you got this organization started when you were working, I think, out of a healthcare facility in Charlestown. Tell me what got this into your head and the people you were trying to help.
Sure. I was working at the Charlestown MGH Healthcare Center, coordinating a wide range of healthy lifestyle programming for youth and families. And one program that I was running in partnership with clinicians at the health center was a nutrition education and healthy eating program, really working with families to help them think about how to adopt healthy lifestyle strategies. And at the same time that I was running this program, the only grocery store in the neighborhood closed down, and I was working for a world-class healthcare institution in MGH, but we had no answer for the fact that there was just no grocery store in the neighborhood. And we couldn't change that fact for the group of families that we were working with. So that's what originally inspired our first About Fresh program called Fresh Truck, which is a mobile market model designed to make healthy food accessible and affordable to low-income communities.
And of course, it sounds to me here is that people have a grocery store if they can drive to it. If they don't have cars, they don't have the income that goes with it. That's a big problem.
Yeah, definitely. Right. Like, and, from where I sat as, a community healthcare provider, I couldn't do anything to change that. I mean, food is so foundational to our health, but it's not an embedded part of our healthcare system. And so that's what really framed all of the work that we do at About Fresh now.
Talk about embedding. As your project evolved, you got to the point where there were physicians giving people gift cards to this program. What did that lead to? Did you find out anything about whether that helped people with their health?
Yeah, we know that it does. It was interesting. That part of our programming evolved organically. We were hearing back from our families that while we were doing a great job bringing food into communities, making it more accessible from a proximity standpoint, while we were making the food more affordable, purchasing power was still a major barrier towards enabling families and empowering them to shop for all of the food that they would want in order to be healthy. And at the same time, we were hearing from healthcare providers, I think witnessing and experiencing the same thing at the point of care in the doctor's office, wanting to pay for the food, right? And so both providers and our shoppers were asking us for some way of addressing purchasing power, and then on the provider side, asking us for a way that they could actually pay for food for their patients. And so we knew that it was an important program. Our Fresh Connect sort of gift card program was an important program before it even started. And so that's what originally got us going. And out of that program and enabling providers through Fresh Connect to cover the cost of healthy food for patients, we've seen that families have, we've heard it anecdotally, and we see in our data that families do buy more healthy food. So addressing that issue, that barrier of purchasing power, has been a major source of support for families that otherwise are having to make hard choices about their diet just because they don't have enough money to afford all of the healthy food that they would want. So the program has been extraordinarily successful so far, and we know that it's meaningful to our families.
I know you use the word culture, because this is not just about, overcoming the financial barriers to food or even the geographic barriers, but you had this bus with a produce section inside, and in normal times, I can picture a fair amount of human contact, people talking to each other about what you can do with the food and why it's so maybe appealing, right?
Sure. Yeah, definitely under normal circumstances when we're operating our trucks. I think one of the most important parts of our program, aside from bringing food into communities that otherwise, healthy food into communities that otherwise don't have access, is the culture building that happens around healthy food, healthy eating, and food culture more broadly. And I think this is especially true with young kids. We have a lot of great partnerships with community-based organizations, churches, health centers, housing developments, peer nonprofits. And we have years-long relationships with a lot of these groups. And so we see a lot of the same kids in particular year over year that are coming to the truck. They recognize me as the fresh truck guy. And they recognize our fresh truck as the fruit school bus. And everybody has their own version of what we mean to their community. But the most important thing for me when I see that kids are beginning to recognize us and identify with us is that we're anchoring memories around healthy eating. That I think are transforming how our next generation is going to think about eating. I mean, I know I grew up eating a lot of really unhealthy food. Healthy eating was just not a part of the culture of my family, and I had to work really hard to sort of, I think, change my mindset, change up a lot of my habits in favor of protecting my own health. I'm hoping that for the next generation, as part of the work that we do, that we're able to stimulate these conversations, these memories, that allow us to sort of just embed health and healthy eating into communities to a greater degree than has been the case, I think, over the course of the last couple of decades as we've transitioned towards eating like more fast food, unhealthy food, and having to resort to that just because it's what's affordable to a lot of families. So I hope we can change sort of that financial equation. I hope we can change the equation of what food is proximate to communities, and then in doing that, affect a larger cultural shift in neighborhoods in terms of how families and communities are thinking about healthy food from a cultural standpoint.
Well, I imagine you're medically informed enough so you're well positioned to see a link between nutrition disparities and the disparities of COVID-19, but maybe you were not prepared for this big pivot that you had to go through. You had to find a way to do what you were doing before, but with a lot less direct human contact. How has that worked out?
It's worked out better than I could have possibly imagined. Our team we're a small team. We're a team of 11. We're 7 years old. We definitely embrace sort of a culture of agility. I think, our organization has always had an identity as being scrappy and really creative, and doing a lot with the little. And as we've grown over the last couple of years, we've been better resourced than we have been in the past. And so we've been able to build up a lot of good infrastructure and systems and process. But as you alluded to, that didn't count for much. Once we had started receiving all of the guidance around how to protect our shoppers against the transmission of COVID-19. But I'm really proud of how our team was able to go back to the drawing board, draw on sort of that DNA of agility, scrappiness, and just creativity. And our team responded really quickly and in a really powerful way to transform our programs in a way that continued to serve our communities while protecting them from COVID-19. So in a span of about 10 days, we transitioned from our mobile market model, of course, which is a perfect vector for the transmission of COVID. We're talking like long, persistent lines, close contact between shoppers and between our staff in tight quarters inside of our trucks, transitioned from that to a completely contactless delivery of fresh food direct to the doorstep of all of the shoppers and all of the communities that we previously served. And so we're talking about an entirely different, logistical model where we're going from dispatching mobile market trucks into communities in a mobile retail model to dispatching individual delivery drivers to the doorsteps of individual shoppers. And it's a brand new sort of just logistical framework. But we're up to serving about 8,000 shoppers a week at this point. And our team, like I said, was able to develop that model over the course of 10 days. And so I shouldn't be surprised, but sort of the magnitude of what we've been able to accomplish in the time frame just has me really impressed with our operations team. I have to just give them a ton of credit for how quickly they've responded and how systematically they've been able to build the program. There's been an incredible amount of infrastructure built up in a very short period of time. And I think we've been really successful up to this point, continuing to carry out our mission while keeping our community safe in the context of COVID.
Now, I know there are some emergency funding sources coming into play, but are you actually getting food to more people than you were before the pandemic?
Yes, we are. We are. And so in addition to that direct-to-doorstep model, we've also sort of transitioned our original mobile market model to a new retail format that's optimized for COVID, where we're selling pre-packed groceries, and then we're adding labor to the market sites to actually ensure that we can manage social distancing. And between that program and our direct-to-doorstep delivery model, we're selling more food than we would be under normal circumstances, which is important given the heightened need as a result of COVID.
Now, I understand that getting food door to door is going to take a lot of volunteers. What has that been like, and do you need more of them?
We do need more volunteers, and it takes an incredible amount of effort. It's extraordinarily labor intensive, and the program would not be where it's at right now without our volunteers. We have anywhere from 10 to 20 volunteers a day. Each volunteer, each delivery driver can do just about 5.5 deliveries per hour under the most efficient circumstances, which is, and that's pretty good based on what we know about sort of similar types of operations. That's a pretty good average rate of delivery per hour. So it's extraordinarily labor intensive. We only expect the need to grow over the coming weeks, the coming months, potentially over the next year. So it's going to be really important that we continue to draw on volunteers to support that effort. So we're really grateful for all of our volunteers up to this point. We've got a lot of people that have been showing up week over week, which is great, right? Because then they're sort of in rhythm with the operation. But yeah, we're absolutely going to have to sustain that over the longer term, as we don't expect the need for this program to go away anytime soon.
Finally, if people do have need, or if they want to help out as a volunteer, what's the best way for them to get some more information about that?
Yeah, sure. If you have a need, you can hit us up on social media at Fresh Truck or at About Fresh. You can email us at COVID-19 response at aboutfresh.org. You can visit us on our website at aboutfresh.org and reach us through our information page. And then you can also call into the city of Boston at 311. And they have a much wider range of resources available for households and individuals that are struggling with food insecurity. And we are trying to reach and be in touch with as many people as we possibly can. We've been working in really close coordination with the YMCA, with the city of Boston, with other organizations that are addressing food insecurity, to make sure that we're matching up everyone with the right resources to meet their needs. And so it really has been a group collaborative effort. So get in touch with us, get in touch with the city. We'll get you to the right place and get you food as quick as we can.